Hi, I'm Jason Kennedy, Ellis County Health Department and Public Health Officer for Ellis County.
Hi, my name is Dr. Heather Harris. I'm a family physician here at Hayes Medical Center, as well as the medical director for the hospital here. And we're here to hopefully get school started and give you some insights to the coronavirus and medically how we can help get back on school started again.
So we know there's a significant amount of fear and hesitancy surrounding coronavirus, especially as it relates to bringing kids back to schools and bringing teachers, students, and really everybody into what is going to be considered a large mass gathering inside a building. So as we look at that, as we look at how we do that, some of these practices or some of the questions that we address today hopefully will help lower some of that anxiety, or at least provide you access to good data and some evidence that shows that we can move forward or should move forward in some capacity as we look at ways to mitigate and safely navigate coronavirus.
It's going to take a lot of patience and bravery and courage to do this, but we know that the students will benefit from getting back to school in a safe manner. We're working through some questions that were given to the school board to help answer some of the questions that are out there.
So Doc, why don't you, I'll let you kind of unpack these first questions, as they are really specific to viruses and how they relate to kids, and really we can maybe hit on some of the adults with that too. So start off, I think the first question is, how do I know if my kid's sick? How do I know if he can go to school, or what's that look like for a kid?
So COVID virus is going to be just like any other illness. That's what makes it a little bit tricky, is it doesn't look a lot different from a lot of other things. So the first thing that we're really asking families to do is to really be aware if you feel like your child is not feeling well. And that will start with a fever, of course. So we're really asking everyone to really take temperatures. Of course, it'll be done at the school building as well. But certainly if that could be identified before they leave the house, that would be excellent. But if kids start having a fever, cough, sore throat, some nausea, vomiting, and diarrhea, appears to be some more GI symptoms with kids than there are with adults. But the symptoms look much like any other viruses. So what we're asking, if kids start having a fever, we want them to stay home and call their primary care physician. If they begin to have a cough with other symptoms, we ask that they stay home and get evaluated by their physician at home. The school nurses are also very aware of the symptoms, and we've been working with them throughout the whole summer to help prepare them on how to triage children to get the adequate care and evaluation if they need it.
So I think the question specifically is, how do I know the difference if my child has COVID or if they have any other virus? And I think it's the safest answer, the safest way to assume is you don't. You don't know the difference. Yep. So you stay home for both. If you're sick, if you have any of the symptoms she went through, so I'll just read what those symptoms, at least what they say the common symptoms are. That's fever, nasal congestion or runny nose, cough, sore throat, shortness of breath, fatigue, headache, muscle aches, nausea, vomiting, diarrhea, poor feeding, or poor appetite. So if you have that, if you don't feel normal, if something is out of the ordinary for you, stay home, call your primary care physician. If you don't have a primary care physician, call any one of the clinics in town. They're gladly accepting patients, or will at least help you find that care you need. Contact your primary care physician and work with them to determine whether you need to be tested, whether you need to just stay home and isolate, whether you need to be treated for something else. Let your primary care physician drive that.
Right. So it's all on triage of symptoms, and they'll help us get on the right foot.
So the next question is, do you get tested regardless if you show signs or symptoms? So no. Can you? Yes. Are there ways to get tested? Yes. Do we have plenty of testing capacity in Ellis County? Yes. Have we ever turned anybody away in Ellis County for
Nope.
lack of testing? No. All of the clinics in town, all your primary care clinics, First Care Clinic, the walk-in clinic at Hayes Med. Hayes Med has a hotline number. Any of those places can help you walk through testing. You call the Ellis County Health Department. We'll find a place for you to get tested. So those are symptomatic people. KDHE, CDC, they're still not recommending asymptomatic testing. Testing does not change your isolation or quarantine period. If you're determined to be a close contact, 2 days later you go in and get tested. You get your negative test results back. Changes nothing. You still quarantine for those 14 days. So Asymptomatic testing is still not recommended by KDHE or CDC. As such, we're not necessarily doing it unless you are determined to be a close contact, at-risk population. If you are long-term care, some of that kind of stuff, there are certain instances where we are doing widespread asymptomatic testing, but for the most part, symptoms determine test.
Correct. And your primary care provider will determine whether a test would be something that you should follow through with or not.
Absolutely. We have a great medical community in Ellis County, and honestly, let's let the doctors be doctors. Call your doctor, work with them to determine whether you need to be tested as we would with other viruses.
All right, so one of the questions is, how long is it safe to wear a mask? We argue that you could wear a mask all day. We have surgeons who stay in the OR from morning till night and are very safe to wear a mask. So yes, the mask takes some getting used to wearing, but it's very safe to use. There's no documentation of any problems with air or breathing. People with asthma and other lung conditions are very adequate to wear it without any problems. So we continue to encourage mask wearing. We know that it will another layer to reduce the risk of transmission of the virus.
And with that safe mask wearing, so safe mask wearing means that you put it on correctly. We won't go through all of that today, but put it on correctly, make sure you're not touching the face of the mask, making sure that you're not fidgeting with it, making sure that you're not touching the face of it, then taking your mask off, then eating, something like that. Washing your hands, so with all mitigation measures as far as washing your hands, social distancing, mask usage, even closures, shutdowns, things like that. All of those work in combination or in conjunction with each other. Quarantine isolation falls into that. So making sure that you're putting that mask on safely. Make sure if you're wearing a disposable mask like we are, actually dispose of the mask. Sure. It is kind of a single-use type of deal or a short duration. What they say, surgical masks less than 8 hours, or it is kind of the recommendation with these. If you're wearing your cloth mask, making sure that you are laundering those. Make sure you have a couple.
Right, several.
And if you can use multiple masks throughout the day that are all clean, if you can have one and then maybe at lunch you change again, or whatever that looks like for you, whatever you have access to, making sure that you're doing that. At least they need to be laundered every single day before you start your next day. We'll stay on the masks shortly. There's a bunch of questions that I am choosing not to unpack right here, as they are policy decisions. But with mask usage, when I can, when I shouldn't, when can I take it off? Honestly, most of that falls back to your policies. What are your policies on when you can or can't? But the important thing of masks is that they work in conjunction with everything else with mitigation measures. So making sure that even if you are wearing a mask, you've got to push that social distancing. Making sure that you're wearing it safely. If you're alone, especially an outdoor environment, you have no chance of ever coming within contact with someone greater than 6 feet. Those are times where you don't necessarily, where you could take a mask break. Outdoors is the best spot for that. Big, huge ventilated rooms, something like that. But the key is wear your mask as much as possible, push social distancing as much as possible, making sure that we limit those person-to-person contacts as much as possible. We also have to realize that with this, you can't mitigate to zero. The mask doesn't give you zero chance. Social distancing doesn't give you zero chance. Even just complete isolation doesn't give you zero chance. You have to get food, you have to do things, we have to move forward with certain things. So there's always going to be a risk. The measures that you put in place, washing your hands, not touching your eyes and nose or mouth, wearing a mask if you can't socially distance, pushing that social distancing is ways that you can reduce or mitigate that risk. How about COVID spread through mediums? So what they refer to as fomite transmission. So Dr. Harris touches that notebook that she passes it. Let's talk about grade and paper. So Dr. Harris is my student, probably a much better student than I am, but she turns in a report, comes to me, I'm grading it. What is the risk of me getting COVID from that surface? Not good.
Right.
It just really almost, so we can't mitigate to zero. I can't tell you it's a zero. No paper can tell you it's a zero. But there really is not much risk from fomite transmission. So any surfaces, doorknobs, elevator buttons, tables, paper, things like that. Now I'm sure that all of you, you guys are educators, you guys are smart people, I'm sure you've read the studies. COVID-19 can live on a piece of plastic for up to 3 days. COVID-19 can live in the air conceivably for 3 hours. These are all studies that are done in a lab, in an absence of atmosphere and in an absence of real world events. Those studies do not necessarily correlate to the real world. So what we found in the real world is that you have very little risk of fomite transmission or contact transmission or transmission through a medium. You would have to, but you guys are educators, I'll tell you straight up, I got 3 little kids, I got an 8, 6, and a 3, so my house is pretty much disgusting because they lick everything and spit on everything and whatever. But really the way for fomite transmission or transmission through a medium is you have to have a sufficient amount of viral material, it has to still be alive, and then you have to transport it from the surface to your eyes, nose, or mouth. So, Dr. Harris hawks a loogie on the table, she's not going to do that. I take it on my hand immediately while it's still wet, place it into my eyes, nose, or mouth. I have a chance of contracting it that way. But, same situation, I wash my hands in between the touch and my eyes, nose, or mouth. I've pretty much eliminated my risk of fomite transmission or transmission through that medium. Cleaning and disinfecting common use surfaces, door handles, knobs. I know that's a unique situation inside a school. There's tons of common use surfaces and there's tons of people, hands, everywhere. Doing our best to make sure that we're pushing that cleaning, disinfecting, but the big key is that you wash your hands anytime you're going to touch your eyes, nose, or mouth.
Right, and another reason for the mask wearing, it will decrease the amount of droplets that are on the surfaces as well. So again, another reduction in that virus transmission. And the other good news is even though the virus is causing a lot of problems, it's not a very tough virus. So that's why simple hand washing destroys the outer layer of the virus and it's not going to hurt us anymore. So keep washing those hands.
Yep, and we've talked about atmospheric conditions killing it. So sunlight kills
Right.
it.
Right.
Really, soap and water kills it.
Right.
Mild bleach solutions, any of your standard cleaners.
Right.
All of that kind of stuff really does kill the virus and eliminates that. But she said with limiting the droplets on there, and then you washing your hands, you've pretty much eliminated your risk of that event right there. So we talked about those. How about we kind of talked a little bit about large gatherings. So the question is, in large gatherings such as conducting school in a school building, is this not a dangerous or risky in terms of spreading COVID-19? Anytime you bring together people
Absolutely.
in an enclosed environment, you have an increased risk. There's no way around it. And so there's no way to say that doesn't increase our risk or increase your risk. How do we mitigate that risk?
We do these things like we're already practicing. We wear the mask. We try to distance ourselves the best that we can. And I'm knowing some of the classrooms are crowded, but continue to do your best on separating the kids and the students apart. The other thing is that people have to remember is that a teacher's lounge, when you're together, keep trying to wear the mask, because that's also a place where we find that people become comfortable, they take the mask down, and now we've exposed some folks. So continue to wear the mask, wash your hands, and just and then if you're not well and not feeling well, stay home. That's been probably one of the most important things we've seen through Ellis County. The reasons we do have a little bit lower numbers is everyone's been very responsible and staying home when not well and staying home when quarantined. And so we've been able to reduce the numbers pretty quickly.
So there's several studies that show really the risk associated of specific events. So where I get COVID. And what those studies show is that you are far more likely to contract COVID in your home setting because you have that close personal contact inside your home. You're far more likely to get it from social contacts as far as mass gatherings like weddings, bars, parties, really of any event where you're not in the public eye. Because a lot of times we start to relax our restrictions. We don't use the masks. We don't, and it's, you throw some of those bad decisions together. You stick them all in a room together, and you get that mixing. Plus, you get a huge mixing of different populations, different people from different areas, from outside your community. So, inside the high school, we are going to have some mixing of different population or kids that maybe didn't hang out with each other over the summer, but they're all from the same county. They're all from the same location. So the risks should be slightly lower if we use the data to show that really your mass gatherings, as far as those parties that bring together huge groups of people or large groups of people from outside of your local area, and when you're at a wedding, you're at a party, you relax your guard. You go there to talk, you go there to mix, you go there to intermingle, you relax those restrictions, you relax your personal decisions, and that's where we see the spread. And at home. So she talks about the teacher's lounge. The teacher's lounge is probably that closer personal connection. At least you guys go there to take a break, to unwind, to do whatever. As you're in there, you need to still push those social distancing measures, making sure you're keeping that 6 feet. You need to implement masks as much as possible. You need to wash your hands, clean, disinfect the common use surfaces. We don't really get an opportunity to relax our guard if we want to mitigate our risk. The HIPAA laws. So there's a lot of questions regarding what happens if we have a positive in a school. What's that look like, or what steps are we going to take? The first thing I'll say about that is I think we need to understand that we will have a positive in the school. We have through this entire thing we've viewed this as a zero-sum game. We've said, well, we're never going to have that. We're going to put in all these measures. We're going to mitigate everything, and we're never going to have it. But the minute you do have it, then you failed in essence. So I think it's okay to say we will have cases in schools. We have a plan in place to deal with that. What does that look like? So the state came out with their modified quarantine guidelines. From the public health office standpoint, our primary function is contact tracing, quarantine, isolation, investigation, all that kind of stuff. Monitoring the situation, looking at community measures, and then being the liaison between the KDHE and the schools of what does it look like. So, will you be notified immediately if there's a kid in the school? Maybe, maybe not. Welcome to COVID. There are no yes and no answers. We all operate in the gray. If you are determined to be a close contact of the child, of the adult, of the parent, of the whatever, will you be notified? Yes, you will be. You'll be notified and you'll be mandated quarantine depending on your situation using the modified quarantine documentation from the KDHE. If we have specific situations, we'll call the KDHE directly. We'll engage with them. We'll have them help us walk us through that process. So, if you're determined to be a close contacts are defined as being within 6 feet for greater than 10 minutes. Masks don't change that. If you're wearing a mask and you're within 6 feet of a positive for greater than 10 minutes, you are determined to be a contact. Now, will you be mandated quarantine? Maybe, maybe not. We're going to use this and the KDHE guidance to determine the situation. Dr. Lee Norman, head epidemiologist for the KDHE for the state. His answer to contact tracing is it's equal parts science and art. We have to look at the situation. We have to look at what it does for the situation. How does that situation determine what is the level of exposure that you had, and how does it fall into the guidelines and the criteria that we have? Now, with this K through 12 plan, they do allow for cohort quarantine within a building. So basically what that would look like is maybe this group is determined to be a contact. There's enough of them, a sufficient amount of them, we have an appropriate location, and we have a teacher that could teach them. Those kids might be able to return in a modified quarantine status. They don't use any kind of common transport, which means they don't ride the buses. They use a separate entrance in and out of the building. They have their own classroom, their own lunch time, their own recess time, their own break time. They have their own teacher, their own bathroom. If we can find a situation that works, and we work with your administration to see if that is acceptable for them, we can set up something like that. If we don't have that, if we don't have those facilities, we don't have a teacher, we don't have the correct resources, then anyone that's determined to be within 6 feet for greater than 10 minutes is mandated quarantine for 14 days from the date of contact. The positive themselves, they are mandated quarantine or isolation for 10 days from either the date of test or the onset of symptoms, or 72 hours post-fever, whichever is longer. So, what that means is, likely, the isolation could return, the positive could conceivably return to school before the contacts. That's because of the latency period of the virus. With this virus, you can become a positive infected for 2 days post-exposure to up to 14 days post-exposure, which means conceivably, which we've got to be careful because throughout COVID we have always operated on what is possible, not what's probable. We have these studies that come out, single point data reference that says, oh, it's possible, but that doesn't mean it's probable. So you could become infected up to 14 days after exposure. The most likely time, what is probable, is 3 to 7 days post-exposure is when the vast majority of infections show up, meaning someone becomes symptomatic or they test. Again, you're still mandated quarantine for 14 days because of that latency period of the virus. With contact tracing, what happens? We get notified of a positive. So we use Dr. Harris. She's got her clinic, her primary care clinic. You go see Dr. Harris. Dr. Harris says, yep, you meet the criteria for testing. She tests. Usually, what are we, still 24 to 48 hours?
For about 48 hours.
So 48 hours later, after she does the test, 48 hours later, she gets the test results back in her office. One of her providers will call you and notify you of that positive. At the same time, usually concurrently, we get notified at the health department of a positive in Ellis County. Once she makes contact with you as the doctor, gives you whatever guidance that you need, then you'll be called by a contact investigator from my office. That usually happens, what we always call within, or so far to date, have always called within 24 hours of notification to us. But what we got to remember is we're already 2 to 3 days out now, depending on when we get the test results back. So you might have tested and not get a call for 3 days, but that's because of that waiting period for the test to come back. We'll call you. What we do is we walk back through your steps. We go 48 hours prior to either the date of the test if you were never symptomatic, or 48 hours prior to symptom onset. The reason for that 48 hours is the pre-symptomatic transmission phase, or what we say asymptomatic transmission. So we go back to that 48-hour mark, we start walking your steps forward. And we see who you had contact with. Contact is defined as 6 feet for greater than 10 minutes. If you had contact, we write that down, we take their name, number, whatever information we can get, and then after we're done, we call those people. That's when notification is made to the contacts. Contacts only go 1 deep, so there's no contacts of contacts. So, Dr. Harris, you know what, I'll say I'm the positive, that way I don't put it on anybody else. But let's say we're sitting up here, I'm the positive. We find out, I start not feeling well, I go to the doctor, I get tested. Dr. Harris is within 6 feet of me for greater than 10 minutes. Yes, we're both wearing masks, but we're outside of the healthcare setting, so these masks don't change our quarantine. I'm mandated quarantine for 10 days, or isolation for 10 days from the onset. She's mandated isolation for 10 days starting from today if her and I don't see each other again for the next 14 days. Now, if we decide to go somewhere after this, or if we decide tomorrow that we want to go play a round of golf, which I actually do, if I see her tomorrow, well, her isolation period starts tomorrow then. And if we continue this contact for 14 days, her isolation period starts every single day until I'm out of isolation. So, if you're mandated quarantine or isolation, do it. Now, contacts don't go too deep though. So Dr. Harris now, she's not the positive, I am. She goes back to her office. The people she works with at her office are not contacts because she's not a positive.
And my family is not a contact. So my family can go, I just have to stay home. But my family can go to work, my children can go to school unless I would get positive. And that's why we ask for kids if the best you can, because if you're an older kid, I know it's harder for the younger kids, that if I could isolate from my family, So now I've had contact with Jason. If I try to isolate myself from my family, if I would become positive, then as long as I've isolated from my family, then they would not necessarily now have to stay home, correct?
Yes,
Okay.
exactly. And that's a good point. Just because Dr. Harris is determined to be a contact doesn't mean her kids can't go to school. Now, Dr. Harris, what should you do inside of your house? You have younger kids.
Right.
They need care from you. They
Sure.
can't do everything on
Sure.
their own. I've got a 3-year-old. She definitely can't do everything on
Sure.
her own. How do I, as a contact in quarantine, how do I help protect them?
So if I'm a contact, I'm going to try to sleep in my own room. I'm going to try to use my own bathroom if possible. If that's not possible, then you just clean all the surfaces with appropriate cleaning materials for those areas after I would use them. I would try to use paper plates so I could throw them away. I would wear a mask around my family as much as possible.
That's the key that I think people are missing is masks work outside the home. Do they work inside the home?
Absolutely.
Absolutely, because we see it in the healthcare field, right?
Right. Every day.
You go into a room, it's kind of similar to a home, I guess.
Sure.
You know, there's more cleanliness
Sure.
standards and all that kind of stuff, but
Sure.
similar situation. If you're positive inside the home, you should be strictly isolated. But we do realize that there's times where that doesn't work. Mask usage inside the home is probably one of the most important things you can do because we know that the predominant amount of infections happens in the home because it's where you have that close interpersonal contact. So, different rooms, different bathrooms if possible, extra above and beyond cleanliness standards, but the key is limiting the person-to-person contact, and if you can't, utilizing a mask inside your home where you feel safe.
Right.
You feel safe inside your home so you can relax your guard, right? No. So using that inside the home will help with that. So I hope we've kind of unpacked that quarantine isolation stuff. I will tell you it's like there's a little art. There's a little art and a little science to try and figure it out. There's a lot of people that have been upset because they weren't notified because they thought they were a contact of this person. It's a small community. And Facebook is a huge community that seems to make us feel like a small community because everybody feels the need to put all their trash on there. So, if you find out on Facebook that that you knew this person or you were around this person that day, and you didn't get a call from us, the only real scenario where that happens is if that person didn't tell me. So they can lie to us. You're going to find this hard to believe, but people do still lie. So they can either lie to us, they can just forget it. I don't honestly know probably who I was around
2 days ago. It'd be very difficult. Very difficult.
Hard. So we probably didn't know. If you find out that you're a close contact, isolate yourself. Quarantine yourself for 14 days from that date of contact. Call the public health department. Say, hey, I was around this person this day. They're likely going to tell you, we can't release any of that information to you as you were not listed as a contact by the individual, but quarantine for 14 days from the last date of contact. If you become symptomatic during that quarantine period, what do?
Call your primary care provider and they'll triage your symptoms and then hopefully arrange some testing for you.
If you don't have a primary care provider, what do?
Then I would reach out to the walk-in clinic, and I think that would be a good place to start other than the emergency room. The other thing to do when you call the offices to set up an appointment, we certainly want you to tell us that you're either been exposed to COVID or you're sick with symptoms concerning with COVID, because we're seeing everyone, but we do have a little bit different process to get those patients in and out of the clinic as safe as we can. So we do want people to tell us that they've been exposed.
Absolutely. And call ahead, right?
We like calling
Call
ahead,
first.
make an appointment. Even the walk-in clinic, give them kind of a heads up that you're coming.
And Dr. Harris works for Hayes Med. I'm sure everybody knows that, but there are other avenues in the community for
Sure.
medical care. Correct?
For sure.
You got First Care Clinic.
For sure.
You've got any of your outlying private
Right?
clinics.
Dr. Knoll, Dr. Hess, yep, depending on their availability.
Hayes Med 1-800 number. Is it still up?
Yep, the Hayes Med hotline, you can find it on the website. It's still a really great access. There's a nurse manning it 24 hours a day to help answer any questions that you may have and help even find a process to get seen and tested.
So we talk about the emergency room. Give me like 10 seconds of why I should go to the emergency room with COVID.
Really, the only reason to go to the emergency room for COVID is if you're having lots of shortness of breath and you can't breathe. The other symptoms, the fever, the sore throat, stay at home, make a phone call in the morning, let someone see you. Obviously, we don't want you know, we want to see you if you're having lots of breathing issues or concerns, but the other milder symptoms should just stay home and be evaluated.
Sure, and that's what we're seeing a majority of.
Right, absolutely.
5% of cases actually are requiring hospitalization. I think in Hayes, they look nationwide, really worldwide. I think they're talking about maybe like 15% of cases require hospitalizations and maybe 5%. That was pretty early data. I think newer data, as we have more cases, it's even farther reduced from that. So running out to the emergency room, probably not your best bet, especially if you've just been a contact of.
Sure.
If you have those severe symptoms, if it's something where you would likely call an ambulance,
absolutely,
it's a reason to go to the ED.
Absolutely.
If it's not, then it's wait, call the hotline number if you don't have a primary care physician, get in to see your primary care physician. Your primary cares are your best access to healthcare because they know your history. They know if you had allergies this time last year and your symptoms were the exact same. They know how that looks for you. Engaging your primary care physician, letting doctors be doctors.
And they've all been doing it for 4 or 5 months now, so they've got it all organized. They're ready to help you.
Students, the entire class. So when we've had some questions with this, will the entire class, so if you have a positive in a classroom, will the entire class be quarantined? No. Documentation from KDHE says that is not a necessity, as those people are not determined to be contacts. Contacts are defined as 6 feet for greater than 10 minutes. Now, will the 4 kids, depending on the layout of the classroom, depending on how much spacing, will the 4 kids that sit around you be quarantined? Probably. That's something that we'll work with the school to see what that seating chart looks like, how much spacing. It might even be, we're in there like looking at desks to see how much spacing we have. It's going to come down to how much mask usage was taking place. We're going to work with the schools to go through that contact tracing to make sure that every kid that is at a greater risk is notified and is mandated quarantine for 14 days. But the entire classroom. So this goes into what we were talking about earlier with types of transmission. So we went through fomite transmission, which is surface. Now we've got airborne and droplet, right? Those
right.
are kind of the 3 main. So to have to quarantine an entire classroom, we would have to see this as airborne transmission. I want to go through like what the basics, so the differences between strict airborne transmission and droplet transmission.
Right, so lots of talk about this. So this is to simplify it. So the virus attaches to the droplets or the snot or the spit in your mouth and your nose. And luckily those are really heavy. So when the kid coughs or sneezes, it will fall to the ground. It's not going to lay lingering in the air for any time. So that's the difference between the droplet. It's not, and we do not feel like typically it's an aerosolized virus, but it attaches to that droplet. It's heavy and it drops to the ground. And we feel like that's sort of that 6 feet, unless you're a great high school football player and can stick a loogie a little further than that. So that's the idea of the 6 feet, the droplets, and of course the whole reason behind the mask is that then it blocks a bunch of that droplet. So we don't feel like there has to be anything really fancy with the air exchange other than that just air is happening in there,
sure,
right?
Sure. Good air in, bad air out.
Right.
So and I will say having bigger spaces, higher ceilings is better too. You just have more air, better air exchange. And what Doc talks about was airborne transmission through aerosols. So what she's talking about is how we, I guess, pre-COVID
right.
viewed aerosols. Aerosols pre-COVID were viewed as basically airborne transmissions. So aerosols were the micro droplets were able to get and spread over long distances. We're not seeing that with SARS or with SARS-CoV-2 with COVID-19. We're not seeing it as an airborne transmission. And there's a lot of talk, or has been a lot of talk recently about aerosols. What they're talking about is droplet nuclei, or micro droplets. Those micro droplets do suspend in the air for a short amount of time, but they have a short travel distance. And their efficacy, or their ability to transmit over long distances, is still just not there. We don't see it. Now, measles, TB,
sure.
airborne, are not. So are not is basically the infectiousness of the disease. How many people I can infect. If I have the disease, how many people can I infect? The R naught of measles, TB is like 16, right? So they think that one person can infect like 16 other people because it's airborne transmission. Gets up, moves, spreads, hangs in the air, fills a room, goes like that. COVID-19 is not that. Close range, short duration, micro droplets, droplet nuclei, aerosols, or standard droplet, large droplet precautions is what they're seeing. COVID-19 has an R naught of somewhere above 1, but less than 2. It kind of depends on what study you look at. 1.4 has been the number they keep coming back to. The reason why I see a low R naught like that is because it's not airborne. At least we haven't found it to be airborne, or that's not the predominant means of transmission. I guess the way to say that is it's not the predominant means of transmission. If it was, we would see the R naught much greater.
Sure.
So as we look at that now, droplets, micro droplets, all that kind of stuff. Masks, what do they do? What's the goal if you're wearing a mask inside a building?
It's just going to reduce the amount of droplets.
Sure. Reduce the amount of droplets, reduce the amount of infection. So that's the goal. That's the intent of this. Washing your hands, not touching your eyes, nose, or mouth.
Right.
All of that stuff. Pushing that social distancing. But 6 feet for greater than 10 minutes, because this is not an airborne virus, or it's not believed to be the predominant means of transmission is through airborne route. We hit those, talk a lot. Secondary exposure, there's a question about secondary exposure. I think what they're talking about is what we talk about.
Right.
If she's a contact of me, I'm the positive, she's not positive, she's just a contact. Do the contacts of her become contacts? And the answer to that is no. And they won't ever become contacts of her unless she happened to test positive. If she tested positive, then we would go back 48 hours prior to the onset of symptoms, start walking through contact tracing with her, then they would be determined to be contacts. So we have more questions about teachers testing positive, kids testing positive. I think we've unpacked most of that. Same rules apply. It doesn't really matter if it's a kid or a teacher. Same rules apply. It doesn't matter if it's administrative staff or if it's janitorial staff or if it's just maintenance staff, whatever. Same rules apply. 6 feet for greater than 10 minutes. So just because a custodian was cleaning the floors outside your room, does that mean that no.
Right.
If you were within 6 feet for greater than 10 minutes of the custodial staff at break or whatever, then you would be determined to be a contact. You would be quarantined or isolated.
So the best setup for every classroom would be the kids spread apart as far as they could and in the same seats as much as possible, right? That way things can be easier traced and less contact. Is that right? With that, as much as possible?
And I think, especially like if you look at, it's tougher with the upper grades as they move from classroom to classroom, but especially in the lower grades if it's possible, keep those kids, they call them cohorts.
Right.
We look at them as cohorts or groups that are the same. But in the younger classes that don't move quite as much, I understand, like, no one wants to sit next to my kid for the entire summer or the entire school year. I don't want to either. So you're going to have to move them some, but move them less. Maybe it's in month increments. So for 30 days, all the kids sit here, then you move every month. It just makes that contact tracing. It doesn't necessarily make you safer,
right? But
it makes the contact tracing easier
right.
if you have that seating charter arrangement.
Maybe less exposure overall,
sure.
if possible.
Yeah. Well, less kids exposed.
Right.
If there is a positive that we don't know about,
right.
There's less kids exposed with less mixing. So, I did see some stuff with, so we talked about the air ventilation. So air ventilation goes back to that aerosol or airborne, good air ventilation. Good air ventilation is good for everything, right?
Sure.
It doesn't matter what virus, flu, whatever.
Right.
There's not.
Dust allergies.
Sure. I don't think there's anything that more ventilation makes worse. So,
sure.
Unless there's a lot of allergies out, you bring them in.
Sure,
but,
sure.
So that good air exchange, just making sure that you have access to that good air. If you don't have a ton of space, take the kids outside for 10 minutes.
Right.
Go get them some fresh air outside on the playground.
Right.
There's questions about can you get it off the playground equipment? No.
Too hot.
It's just not. Is it possible? Maybe. Is it probable? No. So now, can your kid get it from another kid on the playground equipment? Sure. But that's not believed to be the predominant means of transmission. Outdoor spaces are safer than indoor spaces, so how we utilize that, I can't tell you guys. Dr. Harris can't really tell you guys how to utilize that information, but you can. You can determine that. How does that look for your classroom? How does that look for your kids? Frankly, if I spend more than an hour inside of my kids, sometimes I'm about ready to go nuts anyway. So if I could get them outside for a few minutes, let them run around, get some fresh air, those are all good ideas, good plans.
And they can take the mask off when they're outside playing, correct? Outdoor in PE?
So I was going to say, I hesitate to answer some of those questions because it really does go back to your policies, what the school policy, what the school wants. But yeah, if you can maintain that social distancing, and especially outdoors, if you can keep that social distancing or those intermittent contacts, so some kids running by each other on the playground
Right.
without a mask on, that's not a contact, because contact is 6 feet for greater than 10 minutes. We'll even step outside of schools. Dillon's, you go to Dillon's, you should have your mask on. There's a mask mandate. You should wear it anyways. But if you walk past somebody at Dillon's in the aisle that doesn't have a mask, you don't have a mask, they happen to be a positive, you're not a contact. You
Right.
haven't really increased your risk of getting it because of that
It's
intermittent
at 10 minutes,
passing.
right?
It's 6 feet for 10 minutes. So kids playing on a playground, they're never going to sit around for more than 10 minutes. So follow your policies. I know some different schools are going to see this video too. So follow your administrative policies. Follow your policies of your school building, whatever. But yeah, outdoors, maintaining that social distancing, those intermittent contacts, you can relax as long as you're not going to have that close grouping. Level of risk in the community. So what we view as level of risk in the community, and a lot of this comes down to policies as well. So school policies, and each school might have their own criteria, but I can tell you from my office, we view the entirety of Ellis County. And the data we look at is 7-day case increases or decreases, 7-day averages. Because 1 point spike, let's say you go from a day with 3 cases to a day with 11 cases, and then the next day it's 3 cases again. Likely that's some deferred testing.
Right.
Likely we got some tests dumped in that were late, they were from a few days ago. Maybe you had a 0, 3, 11, 3. Probably 3 or 4 of those cases were from your actual 0 day. So we view 7-day case average growth or decline, and we view 7-day percent of positive. So percent of positive is important, and we've heard a lot about it, but percent of positive basically means how many of our tests, what is the percentage of tests that is coming back as a positive result. So Dr. Harris does 10 tests, 1 test comes back positive, it's 10%. So we have a 10% of positive that day. We talk about with deferred testing, some of that kind of stuff. That's what we view as that 7-day average. The percent of positive is so important because it shows what's happening in the community. If you have the same percent of positive, but your testing goes from 10 to 100 tests in one day, but the same percent of positive, and you have more cases, well, of course, because you tested more people. But if on the next day you go from 10 tests to still having 10 tests, so you have 10 and 1, and you go to 10 and 5, you go to 50% of positive, you have much more community spread because you're doing the same number of tests and more people are coming back positive. So we look at the 7-day case growth and the 7-day average of percent of positive. Those are 2 of the important metrics to show what that case or what's it look like in your community. And then hospitalizations. And hospitalizations is something we work with Hayes Med on because they're a regional, right?
Right.
What's kind of your catchment area?
Yeah, we've got 23 counties we help service. So I feel like we have a real pulse on what's happening around us as well.
Right. And all of those other counties could conceivably send patients. They could have patients at the hospital for COVID.
For sure.
That aren't related to our county. But we have to look at all of it in our county because the hospital's here. So to protect that infrastructure, we look at total hospitalizations. We report Ellis County hospitalizations because the other numbers are not our numbers, but we view it as an entirety with Hayes Med. So it's those are kind of the 3 key metrics we look at, and then all of those can change daily.
Absolutely.
And then you can look at small populations. So if I hate to use examples because then when it happens, everybody's like, but let's say you have a team. We'll just say a team.
There you go.
A team that has a bunch of positives. Well, that might not be a reason to shut down the entire school.
Correct.
Because that cohort population, they might, we'll move down on campus for this and move it a little further away from home. But let's say there's 5 kids on a team of 10. All 5 kids live together. All 5 kids have the same enrollment in school, the same classes. All 5 kids practice together. All 5 kids eat together. They do everything together. Those 5 kids might not have impacted the greater population. So how we treat that cohort population, they're going to obviously be isolated, quarantined, whatever, but it might not impact the greater population. So we make sure to look at that as well. How do your numbers impact the greater numbers?
Right, if the 5 kids are all together, if the 5 kids are completely separate, those are 2 different thought processes.
Sure. That's kind of the last question that we have. Doc, I feel like I talked a lot.
No, you did great. No, we're excited for the kids to get back to school. You're going to do great. It's going to take some patience, a lot of creativity, certainly thinking outside the box of the way you normally delivered education to those kids, particularly the littler ones. Trying to limit, again, that grouping, that sitting on the carpet together, for any extended amount of time. But I know you're up for the task, and it's going to be great, and the kids are so excited.
Absolutely.
And we're here to help support the school and all the schools, and whatever, we'll just keep, just like we've done since March, we just continue to approach each battle and figure out each solution as they keep coming, because there'll be more and there'll be different ones, and we'll just continue to work together as a great team and figure out all the solutions for it.
Absolutely. And I give this, I think every time I talk about this, I make sure to tell everybody, everything we said today might be different the minute we walk out that door.
Does
such
evolve.
as COVID.
And same with your administrators.
Yeah. The things that have been constant, though, is washing your hands, social distancing, not touching your eyes, nose, or mouth, and really just limiting those contacts. Those have been the constant from day one.
And the other one that I keep continuing to, if you don't feel well, stay home. That's gone so far in the last 4 months. So stay home if you don't feel good.
And don't wait. How many people are you seeing? We see a lot in our office too that are like, well, honestly, the predominant amount of symptoms for COVID-19 are just so minor.
Right.
That a lot of people are like, well, I kind of had a headache like 3 days ago, but I didn't really think about it.
Right.
And then we pick them up through some kind of surveillance testing, or they go in for a procedure, whatever.
Sure.
If something's out of the ordinary, call your primary care physician.
Yeah, let us walk you through it.
Help you walk you through it. And don't wait. Don't put it off. Don't say, well, it'll just pass. Call them. Let's know what we're dealing with early. I'm excited to get my kids back in school. I told you I've got an 8 and 6. My 3-year-old actually started school today. The look and the joy in her eyes when I told her she could go back to school or she could go to school was just something phenomenal.
They're excited.
Make sure you remember, we don't necessarily control the virus. We control our response to the virus. The basic measures you can take help to mitigate that risk, but we have to move forward. COVID is not going away. It will not go away. A vaccine won't end it. It's not going to leave. It's going to be a part of our community, at least for my lifetime, and at least for everybody's lifetime. How we deal with that, how we move forward, what that looks like, how we control the angst, the fear, and how we make good, safe, smart choices determines what the next year and the year after that looks like. As you do that, how does that impact you? You have to make that decision for yourself. Access good information, stay off of Facebook, get good information from factual sources. Don't view point reference studies and think that that's the end all be all. We've confused probable and possible. We need to make sure that we realize that this virus, we do understand viruses, right?
Right.
We don't know COVID-19, but we know viruses.
Absolutely.
There is good information out there.
There is. And we'll
Use
be
that information.
very smart in a couple of years.
Absolutely. Use that information to guide your decisions. Make smart choices at work, at home, and especially in your personal life. You have your risks are increased the closer you are and the less measures you take, which is why the choices you make outside of work are as important or as impactful as the choices you make inside of work.
Have a great school year.
Be safe.